Hello everyone, and welcome to this audio podcast. This audio podcast is part of Ztom N Perilous. This audio podcast is part of a Storm Robotics production. In this audio podcast, I follow on from the audio podcast as part of the series, looking at the specific susceptibilities in around the CK in around the use of in around the basis of polypharmacy and the CKD population. In this audio podcast, we look at the looking at altered pharmacokinetics and pharmacodynamics in context of the symptomology of uremia. So the heightened risk of adverse drug events in CKD is broadly driven in pathophysiological shifts that alter standard pharmacokinetics and pharmacodynamics, and the most apparent alteration is the progressive decline in amongst EGFR, or estimated glomerular filtration rate, or GFR, or glomerular filtration rate, which fundamentally impairs the renal excretion of hydrophilic pharmacotherapeutics and their active metabolites. However, the pharmacological disruption caused by CKD is multi-dimensional, and it extends far beyond a simple reduction in filtration capability. Uremia therefore induces systemic changes that affect drug absorption or pharmacotherapeutic absorption, disruption, and hepatic metabolism. For instance, gastrointestinal absorption is frequently altered in uremic gastropathy and in around the concurrent administration of phosphate binders, which can chelate or chelate other pharmacotherapeutics within and as part of within and as part of gut absorption. The volume distribution for many pharmacotherapeutics is significantly altered due to fluid retention, edema, and alterations in around pathophysiology. Also, uremia is associated with the substantial changes in plasma protein binding and accumulated uremic toxins, complete with acidic drugs for binding sites on albumin, while basic drugs may exhibit altered binding to alpha 1 acid glycoprotein. This displacement increases the fraction of unbound pharmacologically active drugs or pharmacotherapeutics in systemic circulation, thereby enhancing both therapeutic and toxic effects, even when total plasma drug concentrations appear within normal pharmacotherapeutic ranges. Additionally, emerging evidence indicates that accumulated uremic toxins downregulate the expression and activity of critical hepatic cytochrome P450 enzymes and transport proteins, impairing the non-renal clearance of numerous pharmacotherapeutics. These complex intersecting pharmacokinetic disruptions drastically narrow the pharmacotherapeutic index of many common pharmacotherapeutics, increasing the propensity of chronic accumulation and systemic intoxication of rigorous dose adjustments, which are and systemic intoxication if rigorous dose adjustments are not implemented. That draws this audio podcast to a close. This audio podcast as part of the Ztom N Perilous. This audio podcast as part of a Storm Robotics production.